There are some words that make people instantly uncomfortable, words they avoid saying out loud, words that carry shame, fear, and silence. And yet these words quietly shape millions of lives every single day. Sexually transmitted infections are one of those realities people prefer to believe happen to others, never to themselves, never to someone they love, never to someone who looks healthy, confident, and normal. The danger is not just in the condition itself, but in the way it hides behind denial, in the way it thrives on silence, and in how easily it slips into lives without announcing its presence. Many people are walking around right now feeling perfectly fine, going to work, laughing with friends, planning their futures, while something unseen may already be changing their bodies and their relationships in ways they never imagined. What makes this especially frightening is how common it truly is, how it does not care about age, gender, education, or social status, and how it often waits patiently while time passes and opportunities for early action quietly disappear. These infections have a way of testing trust, trust between partners, trust in one's own judgment, and trust in the belief that it can't happen to me. They carry emotional weight far beyond the physical, touching self-esteem, intimacy, and the way people see themselves in the mirror. Fear often stops people from talking, embarrassment keeps questions unasked, and misinformation creates a false sense of safety that feels comforting but can be dangerously misleading. Some discover the truth by accident, others far too late, and many never realize the full impact until something irreversible has already occurred. The most unsettling part is that waiting, hoping, or ignoring does not make the risk disappear. It only allows uncertainty to grow stronger. Relationships can change forever in a single moment of realization, and the emotional shock can be overwhelming, filled with regret, confusion, and the haunting thought of, if only I had known earlier. Society rarely talks about this openly, yet it affects families, future plans, and even unborn lives in ways most people never consider. There is a quiet urgency around this topic, a sense that time matters more than people realize, and that knowledge can be the difference between relief and lifelong consequences. This is not about blame or judgment. It is about awareness in a world where silence has caused far more harm than honesty ever could. If you have ever felt a moment of doubt, a lingering worry, or a question you were too afraid to ask, that feeling itself is worth paying attention to. Ignoring it does not make it go away. Understanding what is at stake can change how you see your own health, your choices, and the responsibility you carry, not just for yourself, but for others as well. This is one of those topics where staying informed is not optional, where curiosity can be protective, and where continuing to listen could matter more than you think. When we talk about sexually transmitted infections, we are talking about a group of infections that pass from one person to another through intimate contact, most often during sexual activity, including vaginal, oral, or anal contact, and sometimes even through close skin-to-skin contact. What many people do not realize is that this is not one single disease, but a broad category that includes many different infections caused by bacteria, viruses, or parasites, each behaving differently inside the body. Some of these infections can stay quiet for a long time, almost like an uninvited guest that does not make noise at first, while others may cause noticeable changes early on. The reason this topic matters so much is because these infections are incredibly common worldwide, affecting people from all backgrounds, lifestyles, and ages, and they do not choose based on character, cleanliness, or morality. They simply spread when the conditions allow. As a doctor, I often see patients who are shocked because they believed they were safe, careful, or not at risk. And yet they are sitting in front of me dealing with something they never expected. Sexually transmitted infections can involve different parts of the body, including the genital area, mouth, throat, and even the blood. And because of this, their effects can be far wider than people imagine at first. Another important thing to understand is that having an STI does not always mean someone did something reckless or wrong. Sometimes it happens because of a lack of information, trust in a partner, or simply because the infection showed no clear warning signs. These infections can quietly affect physical health, but they can also deeply impact emotional well-being, relationships, and future plans. Many people struggle with fear, guilt, or shame after learning about an STI, even though it is a medical condition like many others that deserves care and understanding, not judgment. From a medical point of view, sexually transmitted infections are important because if they are not recognized and addressed in time, some of them can lead to long-term health problems that affect fertility, pregnancy, or overall quality of life. What makes them especially challenging is that a person can carry an infection and pass it on without knowing, simply because they feel fine and assume everything is normal. This is why education and awareness are so critical. Understanding what sexually transmitted infections really are helps remove the mystery and fear around them and replaces it with clarity and responsibility. It allows people to make informed decisions, communicate honestly, and seek care without delay. If you are listening to this and feeling a mix of curiosity, concern, or even discomfort, that reaction is completely normal. It shows that you care about your health and the health of those around you. Taking the time to truly understand this topic is not about fear. It is about empowerment. The more you know, the more control you have over your body, your future, and your peace of mind, and staying with this conversation could be one of the most caring choices you make for yourself. When we gently talk about what causes sexually transmitted infections, it is important to approach this with honesty and compassion because the causes are rooted in human connection, trust, and sometimes simple lack of awareness rather than bad intentions. These infections are caused by tiny organisms like bacteria, viruses, or parasites that pass from one person to another during intimate contact, most commonly through sexual activity, but sometimes through close skin contact or exchange of bodily fluids. What makes this difficult for many people to understand is that you do not need to feel sick, look unhealthy, or have obvious signs for an infection to be present or to spread to someone else. Many people carry an infection without knowing it, and during moments of closeness, that unseen infection can move quietly to another body. Trusting a partner, being in a long-term relationship, or having only one partner does not automatically remove the risk, especially if either person was exposed in the past and never knew it. Another cause is lack of accurate education, because many people grow up without clear, open conversations about sexual health, which leaves room for myths and false confidence. Some believe that certain types of intimacy are completely safe when they are not, or that infections only happen to people who take extreme risks, which is simply not true. In real life, these infections often spread through ordinary situations where people feel safe and emotionally connected. Alcohol or drug use can also play a role, not because they cause infections directly, but because they can lower judgment and lead to decisions someone might not make otherwise. In some cases, people are exposed because they feel pressured, unable to say no, or afraid to ask important questions, and this emotional side of the cause is something we rarely talk about, but see often in medical practice. There are also situations where infections can pass through blood contact, shared needles, or from a mother to her baby during pregnancy or birth, reminding us that sexual activity is not the only context involved. From a medical perspective, the true cause is not just the organism itself, but the gap between risk and awareness. When people do not realize how easily these infections spread, how common they are, or how long they can remain hidden, the door stays open for transmission. I often tell patients that blame has no place here because most infections happen quietly, without warning, and without intention. What matters is understanding how they occur so that future choices can be made with clarity rather than fear. If you are listening and thinking about past moments, past relationships, or decisions you wish you understood better at the time, please be gentle with yourself. Awareness grows with time, and learning the causes is not about regret, but about protection and care moving forward. The fact that you are still listening means you value your health and the health of others, and that awareness alone can become a powerful step towards safer, more confident choices and a future guided by knowledge rather than uncertainty. When it comes to the symptoms of sexually transmitted infections, the most important thing I want you to understand is that symptoms are not always loud, obvious, or immediate, and that is what makes them so easy to miss. Some people notice changes quickly, while others feel completely normal for months or even years, believing everything is fine while the infection quietly remains in the body. When symptoms do appear, they can be very different from one person to another, and even the same infection can feel mild in one person and more disturbing in another. Some changes may feel physical, like discomfort, irritation, unusual sensations, or changes in normal bodily patterns, while others may show up in ways that feel emotional or concerning, creating anxiety, confusion, or fear without a clear reason at first. Many people describe a sense that something feels off, even if they cannot clearly explain it. This is why listening to your body matters so much. Symptoms can sometimes come and go, appearing briefly and then disappearing, which can falsely reassure someone that the problem has resolved on its own. In reality, the infection may still be present beneath the surface. There are also cases where symptoms appear in areas people do not expect, such as the mouth, throat, or other parts of the body, leading them to dismiss the connection entirely. I often meet patients who say they waited because the symptoms were mild, painless, or not constant, and they assumed it was nothing serious. Others delayed because they felt embarrassed or afraid of what the symptoms might mean. This silence and delay are not uncommon, and they are very human reactions, but they can allow the infection more time to affect the body. Some symptoms can interfere with daily life, intimacy, or sleep, while others are subtle enough to be ignored during busy routines. It is also important to know that symptoms may appear long after the initial exposure, making it hard to connect them to a specific moment or relationship. This can create emotional stress, especially in committed partnerships, where confusion and doubt may arise. From a medical point of view, symptoms are the body's way of signaling that something needs attention, even if that signal is quiet. Ignoring symptoms does not make them harmless, and waiting for them to become severe is never a good measure of safety. I always remind patients that pain is not the only sign of a problem, and the absence of pain does not equal the absence of infection. If you have noticed changes in your body that you cannot explain, or feelings that something is not quite right, that awareness is important and deserves respect. You do not need to panic, but you also should not ignore those signals. Taking symptoms seriously is an act of self-care, not fear. As you listen to this, if any part of it feels familiar or makes you pause, I encourage you to stay engaged, stay curious, and stay kind to yourself. Understanding symptoms is not about labeling yourself or assuming the worst, but about giving yourself the chance to protect your health, your future, and your peace of mind by choosing awareness over silence and care over avoidance. When we talk about prevention, I want you to think of it not as a set of strict rules or fear-based warnings, but as a form of self-respect and care for your body and the people you connect with. Preventing sexually transmitted infections begins with awareness. because when you understand how common these infections are and how easily they can spread, your choices naturally become more thoughtful. Open and honest communication plays a powerful role here, even though it can feel uncomfortable at first. Being able to talk calmly and clearly with a partner about sexual health builds trust rather than harming it, and it creates a shared sense of responsibility instead of silent assumptions. Protection during sexual activity is another key part of prevention, not because intimacy is dangerous, but because protection acts like a barrier that reduces risk when bodies come into close contact. Regular health checkups and testing are also an important form of prevention, even when you feel completely fine, because as we discussed earlier, many infections stay silent for a long time. Knowing your status gives you clarity, and clarity gives you control. It allows you to make decisions based on facts rather than fear or guesswork. Another often overlooked part of prevention is timing and pacing. Taking the time to truly know a partner, not just emotionally but also in terms of health conversations, reduces rushed decisions that people later regret. Avoiding situations where judgment may be clouded, such as heavy alcohol or drug use, can also protect you, because many exposures happen in moments when boundaries feel harder to maintain. From a doctor's point of view, prevention also includes caring for your overall health, because a stronger body and immune system are better equipped to handle infections if exposure ever occurs. Education is one of the most powerful tools we have, and seeking accurate information from reliable medical sources helps replace myths with truth. Prevention is not about perfection, and it is not about judging past choices. It is about what you choose to do from this moment forward. I often remind patients that prevention is a process, not a single decision, and even small, consistent steps make a meaningful difference over time. If you have made mistakes before, that does not disqualify you from protecting yourself now. If you have been careful before, that does not mean you can stop being mindful. Prevention lives in ongoing awareness, gentle honesty, and respect for your own well-being. As you listen to this, I hope you feel empowered rather than scared, because prevention is about confidence, not restriction. It is about choosing clarity over silence and care over avoidance. If this conversation has made you think differently about your health or your choices, I invite you to hold on to that feeling and let it guide you. Stay informed, stay connected to your body, and never hesitate to seek professional advice when you need reassurance. Your health is worth protecting, your peace of mind matters, and taking even one thoughtful step today can quietly shape a safer, healthier tomorrow. When it comes to treatment and solutions for sexually transmitted infections, I want to begin by reassuring you, because this is where fear often softens into hope. Many people hear the words and immediately imagine the worst, but the reality is that modern medicine has effective ways to manage, control, and in many cases, completely clear these infections when they are addressed properly and on time. Treatment always begins with accurate testing, because knowing exactly what is present allows care to be focused and appropriate rather than based on guesswork. Once an infection is identified, a healthcare professional can guide you through the next steps with privacy, respect, and clarity. Some infections can be cured fully with the right medicines, while others may not completely disappear, but can be controlled so well that they no longer disrupt daily life or pose the same risks when managed correctly. What matters most is following medical advice carefully and completing treatment exactly as prescribed, even if you start to feel better before it is finished. Stopping early or ignoring instructions can allow the infection to return or become harder to manage. Treatment is not just about the body. It also involves emotional support, because many patients struggle with worry, shame, or fear of judgment. As a doctor, I want you to know that seeking treatment is a sign of responsibility, not failure. It protects your health and the health of others, including current or future partners. In some cases, partners may also need evaluation and care, and while these conversations can feel uncomfortable, they are part of healing and moving forward safely. Follow-up visits are often important, not because something went wrong, but because confirming recovery or control gives peace of mind and prevents future complications. Solutions also include learning how to live confidently after diagnosis, understanding what changes, what stays the same, and how to maintain a healthy, fulfilling life. Many people fear that treatment will define them forever, but in reality, it often becomes a chapter that teaches awareness, communication, and self-care. Medical support today is more discreet, compassionate, and effective than many people realize, and no one deserves to suffer in silence because of fear or stigma. If you delay treatment, infections can quietly cause damage over time, but when you act early, outcomes are usually far better and far less stressful. I have seen countless patients walk into my office anxious and leave feeling relieved, empowered, and hopeful simply because they chose to seek help instead of waiting. Treatment is not something to fear, it is something to trust. If you are listening to this and wondering whether help would make a difference for you, the answer is yes, it truly can. Reaching out to a qualified healthcare provider is a private, respectful step toward clarity and relief. You deserve care without judgment, answers without shame, and solutions that protect your future. Stay connected to your health, stay open to support, and remember that choosing treatment is not the end of your story, but often the moment it begins to feel lighter, safer, and more in your control. As we gently come to the end of this conversation, I want you to pause for a moment and take a slow breath, because simply listening to this topic already shows care for yourself and courage that many people struggle to find. Sexual health can feel uncomfortable to think about and even harder to talk about, but choosing to stay informed is one of the quietest and strongest acts of self-respect. Whatever brought you here today, whether it was curiosity, concern, or a feeling you could not ignore, that reason matters. You are not alone in these questions, and you are certainly not the only one who has ever felt unsure, worried, or afraid when it comes to this part of health. I want you to remember that your body is not something to fear or feel ashamed of, but something worth understanding and protecting with kindness. Knowledge does not make problems bigger. It makes them clearer and more manageable. If anything you heard today stayed with you, made you think, or stirred an emotion, please do not push that feeling away. Let it guide you toward awareness rather than silence. Reaching out for medical advice, getting tested, or having an honest conversation does not mean something is wrong with you. It means you are taking responsibility for your well-being and your future. Health is not just about avoiding illness. It is about peace of mind, confidence, and the ability to move forward without unanswered questions weighing on you. You deserve care that is respectful, private, and supportive, and those resources exist even if fear tells you otherwise. If this video helped you understand even one small thing you did not know before, then it has already served a meaningful purpose. I encourage you to keep learning, keep asking questions, and keep choosing information over fear. If you feel ready, consider taking the next gentle step, whether that is speaking to a healthcare professional, having an open conversation with someone you trust, or simply staying connected to reliable health education. And if you found this message helpful, staying with this channel, sharing it with someone who may need reassurance, or continuing to listen could help break the silence that causes so much unnecessary worry. Your health journey is yours, and it does not need to be rushed or perfect, just honest and informed. Thank you for giving this topic your time and attention, because that choice alone can quietly change outcomes, ease fears, and protect futures, including your own.